Hi, I'm Joe Graydon.
And I'm Terry Graydon. This podcast of the People's Pharmacy is brought to you by Squatty Potty Toilet Stools. They create healthy toilet posture for fast, easy elimination. Learn more about toilet posture and health at squattypotty.com. That's SQUATTYPOTTY.com.
Many children start staring at smartphones, tablets, and computer screens at an early age. Could it be affecting their vision? This is the People's Pharmacy with Terry and Joe Graydon.
As humans, we rely heavily on our sense of sight, but we may take our vision for granted until there's a problem. Is there anything we can do to prevent vision-robbing problems like cataracts, macular degeneration, or glaucoma?
Dr. Robert Abel Jr. is an ophthalmologist who combines conventional and complementary approaches in his practice. We talk with him about his book, The Eye Care Revolution, and we'll find out about the importance of nutrition.
Coming up on the People's Pharmacy, natural ways to keep our eyes healthy.
First, this news.
In the People's Pharmacy Health Headlines, is pizza making our children fat? Most youngsters and a lot of adults are enthusiastic about pizza pie, with about 1/5 of school-age kids consuming at least one slice on any given day. When they're eating pizza, it comprises roughly a quarter of the day's calories. And when was the last time you saw a teenager stop with just one slice? If it were a healthful dish, this wouldn't be much of a worry, but most pizza is made with white flour rather than whole grains, and it often contains too much salt and fat. The investigators writing in the journal Pediatrics analyzed data from 4 of the National Health and Nutrition Examination surveys ranging from 2003 to 2010. Teens eating pizza took in an additional 230 calories, 5 grams of fat, and nearly 500 milligrams of sodium on the days they ate pizza. The researchers recommend that parents consider pizza in the same category as soft drinks, something to be enjoyed as a very occasional treat rather than a regular meal.
Sodium and salt intake continues to be controversial. A 10-year study of 2,600 older adults in Georgia started with an assessment of how much salt the volunteers were eating. The scientists then tracked how many people developed strokes, heart attacks, or heart failure, and how many died. Although they looked closely at salt consumption, there was no statistically significant association between the amount of sodium in a person's usual daily diet and their risk of death or disease. These data run counter to public health pronouncements encouraging older adults to dramatically restrict salt consumption. Since all the volunteers were at least 71 years old when the study began, it does not seem that older people are especially sensitive to sodium. Trying to get older adults to cut back on salt may not make a great deal of difference for their health, but it might reduce the palatability of many favorite foods.
Some health experts have taken to calling sitting the new smoking. What they mean is that spending many waking hours working in front of a computer or relaxing in front of the television is bad for our health. Canadian researchers analyzed data from 47 studies and determined that people who spend a lot of their day sitting down have a significantly higher chance of developing heart disease, cancer, or diabetes. The scientists found that the risks start to rise when people sit for at least 8 hours daily, whether they're driving, staring at a computer screen, or watching TV. Those who think exercising for half an hour a day will undo this damage are mistaken. While exercise is better than no exercise, the bottom line is to spend less time on your bottom.
Exercise is better when you have a buddy. That's the finding from a British study published in JAMA Internal Medicine. The investigators queried over 3,500 couples in 2000 and have followed up with them several times since. These middle-aged people were more likely to improve their health behaviors and increase their physical activity if their partners participated. 70% of men whose wives joined them at the gym or running on the road were able to increase their fitness, and 36% of women whose partners joined them in a weight loss effort shed pounds. That's compared to only 15% of women whose partners were not interested in weight loss and 26% of men whose partners did not join them in exercise. This shows how people can support their spouses in positive health behaviors.
2 articles in the New England Journal of Medicine regarding a new class of anti-cancer drugs show substantial benefit. Nivolumab is a monoclonal antibody that blocks a protein called programmed cell death, or PD-1. The brand name is Opdivo. In one study, patients with Hodgkin's lymphoma who had relapsed or were resistant to existing treatments were given nivolumab. The investigators reported a substantial therapeutic effect, with 17% of patients demonstrating a complete response and 70% experiencing a partial response. The other study reported patients with metastatic melanoma. They also had benefits from nivolumab. An editorial accompanying this research was titled, "Release the Hounds, Activating the T-Cell Response to Cancer. Immunotherapy for Cancer is Finally Coming of Age." And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Most of us take our vision for granted until something goes wrong. We incorrectly assume there's nothing we can do to keep our eyes healthy. When myopia, glaucoma, cataracts, or macular degeneration strike, we rely on surgery or pricey prescription medications. But what if there were natural ways to preserve our vision?
Today we're talking about eye health with our guest, Dr. Rob Abel. He's an ophthalmologist who teaches and practices both complementary and conventional medicine. He's author of The Eye Care Revolution: Prevent and Reverse Common Vision Problems.
Welcome to the People's Pharmacy, Dr. Abel.
Thank you very much. Great to be with you, Terry and Joe.
It's great to have you back on the People's Pharmacy, Dr. Abel. You know, in the 3rd edition of your book, you mentioned something called interactive medicine, which I find quite fascinating. We've heard the words integrative medicine, but what do you mean when you say interactive medicine?
What I mean is when the patient and the doctor interact in a way that they are equals. I always believe that the patient can make the diagnosis at least 80% of the time if they only had the wherewithal and the construction to put the symptoms and the epidemiology together, so that listening by the physician, observation by the physician, and helping to channel some of that information by the patient makes it interactive.
Dr. Abel, this sounds like something called participatory medicine.
It does indeed.
Wow, that's exciting.
We love it because we were founders many years ago of the Society for Participatory Medicine. It's something we have dedicated our careers to. Let's move on to another idea that you mentioned in this 3rd edition, and that is the eyes as windows into the body, a mirror, if you like. What do you mean by that? What can be revealed?
Well, taking a simple story, diabetics need to have an annual dilated eye exam. And that's because it's the only place in the body you can actually see the blood vessels and any leakage from the blood vessels. Well, you can also see thyroid on the external eye, liver function. Blepharitis is a function of GI function at times. And with the OCT device, that is a computerized tomogram that can look at the nerve fiber and ganglion layers in the retina, we're going to be able to predict who is increasing chances of MS, Parkinson's, and Alzheimer's. So you can go through many diseases, including hypertension, diabetes, heart disease, cholesterol, etc. And when they're abnormal, you may have some observation effect inside the eye because it's your one shot at looking at the front of the retina and the whole of the body.
You know, this is fascinating, and there's so much to talk about here, but I want to focus on maybe even not the most important piece of it, but something that's very, very common that people often have a lot of trouble with, and that's blepharitis. First of all, it's a very fancy name for a really common condition. Can you tell us about it, please? And what's the connection with GI problems?
The problem is going to be your oils. When your car oil is getting old, the pistons don't work so well. When you're loaded with omega-6 and inflammatory oils, they will accumulate in various places, including the oil glands in the eyelid. The lid is called the blepharo. So blepharitis is inflammation of the lid. So when you have inflammation of the eyelid oil glands, it will ruin your tear film, simulate dry eye, give scales, redness, styes, and bumps in the lid. So changing your oil to higher omega-3, getting a more natural ratio between 3 and 6, will improve the eyelid. So your GI function has a major role. Your GI function also has a role in digestion in general. So if people are taking antacids and Nexium and other kind of PPIs, what happens is they don't fully digest their food, so they don't fully get all the nutrients in. And along with having the higher toxic oils, that will affect the conjunctiva and the lid. So again, the eye and the eyelid is again a mirror of systemic findings. And an article just came out in glaucoma in mice. If you block the lymphatics, the mice will get glaucoma, i.e., if you're not breathing normally, your lymph doesn't drain, you have a backup into the eye, and the fluid in the eye doesn't circulate and exit normally. And again, you may be getting glaucoma from a systemic phenomena. And in terms of participatory medicine, we work together to help figure out where the cause is instead of just treating the symptom all the time.
Now, you mentioned one other thing. I mean, because, I think a lot of people have heard, high blood pressure, hypertension, that the ophthalmologist will actually look and see if there's some damage, ditto for diabetes. But you said thyroid. How can you diagnose a thyroid problem through the eye?
Well, for instance, you see it when there's some damage, puffiness of the lid, puffiness of the conjunctiva. But the current thyroid tests test the amount of protein, the T3 and T4. They don't test the activity. And my belief is the chlorine and the fluoride knock off the iodine from the thyroid hormone. So you get the right amount of protein, but you don't have active thyroid hormone. So the actual best test is putting a thermometer under your arm before you get out of bed and leave it there for 2 minutes and see if you're 97 or above. And if you're not 97 or above, there's an excellent chance you're hypothyroid. Of course, there are other symptoms of dry skin, puffy eyes, swelling in different places, loss of hair. But this is a way that people can sort of check themselves and see if their synthroid, which often is only 20% effective, is doing the job.
Now, Dr. Abel, you also talk in the third edition of the Eye Care Revolution about merging modern, very high-tech approaches with some very age-old approaches to taking care of our eyes and our health. And can you give us some examples and then possibly tell us about your trip to Nepal?
Well, let's start with nature versus nurture. We're getting very sophisticated and can do genetic testing for people who have a propensity for diseases. And that is kind of like genetic determinism. However, epigenetics are at least as important because the methylation around the chromosomal genes has an effect on what develops in each particular cell, because you have the same chromosomes in your liver as you do in your cuticle and your fingernail, and why one goes one way and why goes the other. Plus the fact what you do, what you eat, what nutrition you supplement with, and your lifestyle has a major effect on what is the outcome in terms of tissue, disease, health, and wellness. The interesting thing about Nepal, as you said, is that Ayurvedic medicine, or Buddhist medicine, is based on trial and error over a couple millennia. And they also feel, like the Chinese, that you don't treat somebody with one medication for all gender, all age, all body types, but you change it every 10 to 14 days as the person changes. So if you want a clue from Ayurvedic medicine is change the medicine and also look at the body type of people, and you'll have an idea of what disease propensities are going to be present.
Now, our listeners may be thinking, oh, this is a fruits and nuts kind of doctor like we hear on the People's Pharmacy all the time. But you're an ophthalmologist. You do cataract surgery on a regular basis. You use all of the tools of the trade, so to speak. Am I right?
You're correct. I mean, I've gotten the Senior Honor Award from the Academy of Ophthalmology. I've been invited back again to speak at the Royal College of Physicians in London because they could not find a UK ophthalmologist that knew anything about complementary medicine. But I realized in the 1980s that operating on cataracts, of which I've done 20,000, is operating on a symptom and not on a cause. And as you go back in the cause, you find that the eye is a biochemical workshop. There is virtually no additional nutrition in the eye because it's a bag of water with light being focused on the highly sensitive retina. And all of that nutrition's in the liver. So the eye has to require a number of things, including at least 5 hours in the dark at night to get replenished. So not only do I do traditional ophthalmology because it's one of the most fascinating and interesting high-tech areas in the world, but I also look for the simpler options where people have less of a copay.
Well, tell us a little bit then about preventing cataracts.
Well, preventing cataracts is wearing sunglasses. Article just came out about melanoma increase in people who work in airline industry in the sky. We've known that pilots have a 60% higher incidence of cataracts. Astronauts have a 35% higher incidence of cataracts, and they're healthy people and may only go up once. Mountain climbers have about a 40% higher incidence, mountain climbing guides. So there's no question that the UV light, the toxic short wavelengths, get absorbed by the lens, which is protecting the retina, and the lens proteins breaks down. So the simplest thing is that. Vitamin C and glutathione are key ingredients inside the lens. Lutein is a minor ingredient in supporting the lens. But these are all ways in terms of general health, but also protecting the lens from breakdown of protein.
You're listening to ophthalmologist Rob Abel. His book, The Eye Care Revolution, is just out in its 3rd edition. Dr. Abel includes both conventional and complementary medicine in his practice.
I can see clearly now, the rain is gone. I can see all obstacles in my way. Gone are the dark clouds that had me blind. It's gonna be bright, sunshiny day.
We need to take a short break. When we come back, we'll learn more about cataracts. Can they be prevented with carnosine eye drops?
We'll also learn about macular degeneration.
What foods does Dr. Abel recommend for eye health?
Are there drugs that interfere with vision? Which ones are they?
What is glaucoma and what can be done to prevent it?
It's gonna be a bright, sunshiny day.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like this podcast of the People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Redx Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
And by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
If you'd like to order a CD of this show, you can call 800-732-2334. This is show number 978. That number again, 800-732-2334, or find it online at peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about our vision and how to take care of it. Our guest is Dr. Rob Abel, an ophthalmologist with a keen interest in both complementary and traditional medicine. He's medical director of the Medical Eye Bank of Delaware and author of The Eye Care Revolution, now out in its 3rd edition.
Dr. Abel, you were just talking about ways to prevent cataracts in the first place, wearing sunglasses that have a really high UV filter, so 99.9% hopefully. And you mentioned a few nutrients. Could you tell us what those nutrients are again, and what else we can do if there are the beginnings of cataracts?
The nutrients are vitamin C, like 1,000 milligrams a day, which is probably normal for anybody who is trying to take care of themselves and supplement. Glutathione boosters, which will build glutathione, whether it's NAC, SAMe, alpha-lipoic, or MSM, because the sulfur is critical in maintaining protein structure. And the lens is about 35% protein. So it's a very desiccated thing like a fingernail, and except it doesn't grow out, it grows in. And lutein is about 20% risk reduction to cataracts, and a little bit of some of the B's, A, and E are effective as well. The Russian scientist Mark Babysharov has found 12 years ago that topical carnosine eye drops may reverse some of the protein denaturation in the lens and reverse cataracts. And a number of years ago, I did about 12 people, and 3 of the people reversed their cataract. So recently, we finished a 6-month study, but the problem was most of the people ended up in the blinded study getting placebo. And 50% of the people who got the real thing got some small improvement in their lens opacity or subjective vision over 6 months. Now, that wasn't great enough. So we're going to then do just an open study now with a lot of people getting the real drop, which is a combination of carnosine, NAC, glutathione, C, and bilberry, though I don't know how much that will do. So there's obviously evidence that there's a nutritional approach. We know that eye drops get in the eye. There's even an eye drop being evaluated to stop bleeding in the retina so people do not need all of those injections every 2 months. So we know that we can get things through the cornea and into the lens.
Now, I think what I heard you referring to is something referred to as macular degeneration. And right now there's some very high-priced prescription drugs that are actually injected into the eye. First of all, how good are they? And number 2, is there anything else? Well, describe macular degeneration first and tell us what people might be able to do to reverse the problems.
Well, first of all, the macula is the center of your retina. It's a tiny little valley straight ahead back in the eye, and it receives light without interference of blood vessels over top of it. As I said before, that all the nutrition's in your liver. So you're constantly barraged by photons and light images, and your breakdown, build up, and it obviously can wear and tear. You start losing cells, you lose the underlying pigment layer, you develop drusen, etc. Sometimes it's just the dry form, but sometimes the dry form actually progresses and new blood vessels trying to help out are so fragile that they leak, and that is leakage into the retina in the wet form. The injections are ways of stopping the new blood vessel growth, and that many times the fluid will absorb, and people will get much of their vision back.
So those injections would be drugs that are used for anti-angiogenesis then, right?
They are anti-angiogenesis drugs.
Which are drugs that block the formation of new blood vessels. They're usually used in treating cancer.
Usually indeed. In fact, the first one is the common one, and Avastin has been used for colon cancer and costs $60 a bottle, from which you can treat 10 patients. But the same company makes another drug, Lucentis, which is $1,600 a bottle for one patient. And think about the fact that these two drugs are similar, have similar effectiveness, and the only difference beside the price is that Lucentis went through the FDA, and since Genentech owns Avastin, they didn't want to compete with a lower-priced drug, so they never put it through the FDA. So most retina doctors still use Avastin because it's cheaper for one and all. The top three costs for Medicare nationally are three eye costs: the injections, cataract surgery, and cataract lasers. So obviously, if we can prevent macular degeneration in cataracts, we're doing our economy a whale of good.
Well, let's talk about that a little bit more then. You mentioned earlier, before we got into the injections, that there was a potential alternative for injections that might be absorbed through the cornea. What kind of eye drop do you give for macular degeneration, and how well does it work?
Well, historically, we don't do eye drops for macular degeneration because if people have a normal lens of the eye, it's going to block it and absorb it, and it's a long pathway to the back. We generally go systemic by either swallowing something or injecting around the eye. It's limited uptake of anything by eye drop. So it's much better to prevent macular degeneration by taking the nutrients by mouth, usually with food, because many of these nutrients are fat-soluble, A, D, E, and K, and the omega-3s. Realizing that your retinal receptors are 50% omega-3, DHA. Being on DHA is important. Women who have multiple children have given away the omega-3 from their brain to make their children's brains, and they often don't catch up and have more chronic diseases like dry eyes, osteoporosis, even cancer, etc., because they have lost this essential cell membrane ingredient. Other nutrients are important: taurine, zinc, vitamin E stabilizes cell membranes, somewhat vitamin A, magnesium improves dilation of blood vessels. Some of the B vitamins are important, but improving your diet in general and a normal balanced diet are two combination items that are important.
Are there any specific foods that you always recommend your patients be getting adequate supplies of?
Fish, spinach, kale, collard greens, anything green. Nuts, berries have high nutrients. Even eggs and egg yolks, once touted as causing difficulty with cholesterol, are excellent sources of protein and nutrients. And as an aside, many experts are now saying that treating a cholesterol of 200 may be inappropriate because we need it to build the structure of cell membranes and our hormones.
Well, speaking of cholesterol, one category of prescription medications that has been super popular for the last couple of decades are the statins, drugs that we know as Lipitor and Zocor, or that are available as atorvastatin or simvastatin. Crestor is rosuvastatin. There have been some reports that statins may actually increase the risk of cataracts. Your thoughts about that?
Correct. What happens is they inhibit the selenium-dependent enzymes. They inhibit CoQ10, but they inhibit glutathione synthesis. And so, therefore, in animals, it's been demonstrated clearly, and there have been 2 papers in ophthalmology that show an increased risk. But statins do a lot of things. What I recommend for people who have borderline cholesterol is to increase their vitamin D. Because if you look at the chemical formula of what vitamin D is, it's irradiated cholesterol. Well, you're not out in the sun getting that UV light, so you take vitamin D supplementation with a meal with some fat. And what happens is, in certain people, their cholesterol starts dropping because you stop requiring more precursor, which is the cholesterol.
What other drugs can increase problems for the eye? We've heard that corticosteroids, drugs like prednisone, can pose problems. Are there other medications as well?
Well, prednisone is sort of ubiquitous because people get sinus disease, let's say from milk allergy, chronic sinus disease. They end up on a steroid. They inhale the steroid. It's very close to the eyes. And ultimately, they have a higher chance of glaucoma and cataracts. They inhale it for asthma. So we have more of these very subtle chronic diseases going on. But yes, there are about 130 drugs that can throw people into an attack of glaucoma if they have a narrow angle situation where their iris is very close to the cornea. And having a routine eye exam will detect that usually well in advance of that possibility. So if people do have glaucoma and they hear don't take these drugs, it really depends on that small group in the population that have a narrow angle. Antihistamines are a part of that, etc. But any drug that's a photosensitizer, like antibiotics, antihypertensives, increase the effect of the UV light on the lens, breaking down the lens. So once again, wear the sunglasses during peak solar hours, and you protect against that.
Dr. Abel, what is glaucoma? I thought it was always just about too much pressure in the eye.
Glaucoma is damage to the optic nerve.
Is there a good way to find out which drugs are photosensitizers?
Your pharmacist.
Okay.
Your best friend.
One other question then. Before we move away from photosensitizing, which I think is an important topic, especially for protecting the eyes, there are some herbs and some foods that might be photosensitizing. How can we find out about them?
I would call you, Terry.
Okay. Well,
But
then we'll tell everybody
But
that...
I would tell you, lutein helps block glare and light sensitivity.
Okay. Well, St. John's wort is the herb I'm thinking of.
Oh, great.
Because it can be phototoxic and photosensitizing and phototoxic, and it can actually cause eye damage if people aren't very careful.
Thank you.
Tell us a bit more, if you would, please, about glaucoma. How would someone know if they had a narrow angle, and what are the approaches that we should all be taking to protect our eyes?
Well, there are very few benchmarks that people can tell themselves. They can see if they're seeing well. They can determine that. They can determine at the end of the day, are their eyes fatigued? They can determine how long it takes them to recover from headlight glare. But they can't determine the anatomy inside their eye. And so regular eye exams are extremely helpful. And especially if they have issues or family history, they should write those questions down. But it's very hard for people to know. But once they do know something, they can do certain examinations. Like, for instance, I've worked on a brochure with a couple tests with an Amsler grid that's a quick test of macular function, a contrast sensitivity chart, which is even more defined than the usual visual acuity chart, a red-green chart. Immediately you can see if the letters on the green stand out more, you're still on the nearsighted side. And if you have cataracts, you tend to get more nearsighted. The letters on the red, if they stand out more, you're more farsighted, and you may be undercorrected, and that's why you don't see signs down the road, at night, etc. So usually you need some extra device, some help, or an examination in order to determine the health of the eye and the potential of these kind of things.
Now, it's always been my understanding that when pressure in the eye starts to go up, and that's one of the tests that's often done by the optometrist or the ophthalmologist, that's when the red flags start waving and people start talking about, well, we've got to get the pressure down. And in the old days, that used to be beta blocker drops, drugs like Myopic. But now we have new drugs. We have Zalatan, for example. So give us a little sense of this issue of pressure and what to do about it.
The two major models of glaucoma are elevated pressure and poor blood flow in the optic nerve at night. Elevated pressure is something that's measurable. that's quantifiable and you can follow. And at the same time, you have the benchmarks of doing photography and visual fields and corneal thickness to know if it's dangerous or not. The sneaky one is the thief at night, because what happens is people lie down at night, they're relaxed, their blood pressure drops, but their eye pressure is highest between 12 and 2 at night. And if their blood pressure is low, what happens is that's where they lose the nerve fibers. For instance, a 90-year-old lady gets put on hypertensive medication. What happens is it's great for 8 in the morning when she's sitting on a cold doctor's table without any clothes on and getting her blood pressure measured. But when she lies down at night, which is totally different in her normal habitus, it's way low, and that's when she's vulnerable to loss. So poor blood flow at night, ginkgo, magnesium, and not taking blood pressure medicines after the morning are important. And even changing medication is needed. A third model is sensitizing medication or chemicals like artificial sweeteners. Glutamine is twice the level in the eye of glaucoma people as it is in normal people. The glutamic acid and its use as a neurotransmitter, somehow too much is affecting the nerve fibers, etc. And the last one is high lymphatics, that mouse model story I just told you, that if people don't breathe well and don't lower their lymph and their jugular venous flow, their eye pressure will be elevated. So you have 4 different things. People can start helping out the doctor by determining what factors they have. People with chronic lung disease will have a higher eye pressure, but they may not have damage. But fortunately, regular eye exams can benchmark this by different studies.
You're listening to ophthalmologist Rob Abel. His book, The Eye Care Revolution, is out in its 3rd edition. Dr. Abel includes both complementary and conventional medicine in his practice.
And Dr. Abel has emphasized the importance of a regular eye exam, and we want to emphasize that as well. It's really important to catch these eye problems ahead of time and be able to do something. We need to take a short break. When we come back, we'll find out about nearsightedness in children. Is it becoming more common, and if so, why?
What should we know about dry eyes? Is there a link between dry eye and arthritis?
What can be done to treat a lazy eye?
Is there a link between vision and attention difficulties in children like ADHD?
And what is pink eye or red eye, and what can be done about them?
What role does sleep play in eye health?
We'll also get Dr. Abel's recommendations for keeping our whole bodies healthy.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website where you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Redx Industries, makers of utterly smooth foot cream with shea butter, helping dry, cracked feet feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, the number to call is 800-732-2334. Today's show is number 978. That number again, 800-732-2334. Or place your order online at peoplespharmacy.com.
Today we're talking about how to prevent and reverse common vision problems. Our guest is Dr. Rob Abel, an ophthalmologist who teaches and practices both complementary and conventional medicine. He's author of The Eye Care Revolution.
Dr. Abel, it seems that more and more children need vision correction, whether they're wearing glasses or contact lenses or whatever it is that they need. Is it true that we've got more kids with nearsightedness?
There's an epidemic of myopia that's global, is related to confined spaces, and even more so to computers, texting, etc. 93% of Taiwan is myopic. 50% of Swedish recruits, military recruits, are myopic. 42% of American children are myopic, where it used to be 22%. And this number is increasing because close work somehow through the convergence stimulates myopia. So the moral of the story is look away, look at the moon every night, but and seriously, every 45 minutes or so, look away for a full minute. And that will be so important to help break this trend of myopia that is not genetic. It's very interesting because the Chinese have used atropine, they have used acupuncture, etc., to stop myopia. But at the same time, they're starting to try and limit the close work.
Well, of course, trying to talk a child into not texting, not looking at their cell phone, not using their computer or their iPad, I mean, that's going to be a challenge to say, oh, now you need to go out and play. No, we're not playing. We're sticking with our games or with our messages or with our homework, and it's all electronic these days. So how do we actually change behavior?
Well, I think addiction is sort of part of human existence. And you implied about the statin drugs earlier. You know, you have these glorious ads on TV that say, take a drug and you relieve a problem. You have the doctors buying into it to reinforce it, and the company spending millions of dollars. I mean, you take things like Restasis for dry eye. Well, if it takes 6 months to work, something's wrong with that model. But yet it's selling like wildfire. So it's very difficult to get past the seductiveness when they keep coming up with new apps and new things and new games. But somehow I think that balanced people will try to have balanced children. And that's the only way to deal with it.
Now, speaking of dry eyes, we've actually heard that staring at a computer screen for hours on end without blinking may be a contributor to dry eye.
Certainly. And it certainly is, because even driving, for some people, because they're staring, they don't get their normal, 6 blinks a minute in, their eyes are going to evaporate. And especially if they have omega-6 in their tear film and don't have a good lipid layer over the tears, it evaporates. But correct.
Dr. Abel, you've written in the Eye Care Revolution about a link between arthritis and dry eye. I'm wondering if you would expand upon that, please, and tell us what is the link and what we can do about it.
Well, I mean, sometimes dry eye you think of not enough watery tears, but there's oil, water, and mucus. And the oil comes from your meibomian glands, which are in the lid, about 60 of them in each eyelid. And if there's inflammation in those glands because of the oils that you're taking in your body, the omega-3, 6, and perhaps others, those same oils play a role in joints as well. So Sjogren's syndrome is dry eye, dry mouth, and arthritis. So that's a common one that knows that membranes have a commonality in terms of dryness, and that you may be able to reverse that by decreasing the inflammation, sometimes with a steroid for a short period of time, like a week, and then by slowly improving people's omega-3, giving them an oil change, so to speak.
We were talking a minute ago about this epidemic of myopia and nearsightedness in our children, and maybe in ourselves as well. I'd like to talk about another condition that affects kids. It's called amblyopia, or lazy eye. Is there anything that can be done for it?
Well, up to 3% of people, which would start with children, have a lazy eye. Half of those are due to a muscle imbalance, where one muscle is overactive and throws the eye off center. But the other half is due to a refraction imbalance, meaning one eye has a different prescription than the other. And, of course, the child doesn't verbalize it, but the brain understands it and picks the less complicated television station to watch and lets the other one wander. Often it's just a little bit, so you don't even notice it and pick it up, unless you were to do cover one eye at a time and watch the child push your hand away when you cover the good eye. Behavioral optometry and exercises can actually reverse the situation in many people. A gal wrote a book called Fixing My Gaze, and how a 50-year-old professor at Mount Holyoke College, after 3 eye operations and one terribly lazy eye, after 15 months, got excellent vision, infused her vision, got depth perception. And it made the people who got the Nobel Prize for their amblyopia work have to refute what they said, because it is possible to improve people. Neuroplasticity is phenomenal. We notice it all the time. When you block out the kid making noise on the subway while you're reading your paper, and somehow it disappears. We have great plastic ability to adapt our brains, and believe it or not, eye muscles are one of those things.
That sounds like very good news.
And for amblyopia, instead of patching the child incessantly, there's now the option of either putting atropine to blur the good eye or acupuncture that the Chinese are talking about to improve the bad eye. So, when you open yourselves up to other systems that are plant-based nutritional systems, it certainly does complement the high-tech possibilities and surgical intervention possibilities.
Dr. Abel, when you say that the eyes are a window into the body and its health, obviously the eyes are, in some respect, a window into the brain. Is there a connection between vision and attention deficit hyperactivity disorder?
Well, when you realize the retina is an extension of the forebrain, and you realize that each nutrient that is good for the eye is good for the brain. For instance, D3 and omega-3 DHA both protect against macular degeneration as well as protect against cognitive decline. When you realize whether it's hallucinations, whether it's migraines, etc., you start realizing that the vision system is so important in the brain. In fact, 40% of the brain is devoted to vision functions, the functions and information that come through the eye. So there is no question that there is a relationship between the two. And many kids who have learning disabilities will improve both with educational procedures, but also with higher levels of omega-3, and obviously avoiding too much sugar and too many stimulants. So the short answer is yes, that the eye is critical and is one of the major inputs. Prioritization, of course, is important. And being dyslexic myself, I've gone through the items intensively and nearly failed third grade.
Well, you certainly have excelled since then. I do have a question that is also very common in children, and that's something called pink eye. It doesn't last very long, but it can be quite disruptive when it occurs. And there is something also that lasts a long time, and people have used eye drops for it, and that's red eyes. In fact, they used to advertise those eye drops as to get the red out. So first pink eye and then red eye.
The panoply of colors. Pink eye is if you don't touch your eye, you don't get pink eye. How's that for something simple? So pink eye is an external infection, usually virus, and you get it from touching the credit card machine. You get it from the escalator. You get it from picking up the pen at Walmart when you sign your card slip. So when you use your own pen, that will be extremely helpful. If you wash your hands frequently, that is helpful. And even though sometimes it is actually a systemic upper respiratory infection that the eye membrane gets involved, many times it is basically touching the eye. And historically, ophthalmologists and optometrists have spread the virus because they inadvertently didn't clean the equipment, and the next people down the line get it. So we know by Koch's postulates that it's an external infection. Red eyes and red rims come through a variety of things because people have distended blood vessels. People who are overweight with rosacea get red rims. People that have digestive difficulties, the Chinese say, will get red eyes. Red eyes is usually a little more than your blepharitis and scales. It is your conjunctiva becomes red, etc. It comes from rubbing, and it comes from chemical sensitivities. And many people have multiple chemical sensitivities, one of which is the preservative in eye drops is a quaternary ammonia group. So think of the person with a red eye going to 5 doctors, getting 5 different drops, never getting better. You think that the preservative in the eye drop is the issue that's holding them back. So the red eye may be external, it may be internal, and again, seeing an ophthalmologist or a cornea specialist to differentiate what are the possibilities and then what's the treatment.
Dr. Abel, tell us a little bit about sleep. How important is sleep for our eyes and our vision?
2 gentlemen from Alaska told me if they didn't get 5 hours sleep, they had blurry vision throughout the next day. And that was a clue about 5 hours because you need to rest your body for your liver to be pumping out to the provinces instead of just your muscles in your gut. Sleep apnea is insidious in people. They get floppy lids. They can get keratoconus, incidence of glaucoma, retinal occlusions, etc. And they can get all kinds of annoying things like dry eyes, blepharitis as well. So knowing sleep pattern is important. Having the sleep is important. And I once told somebody to say, well, how do you know if you're sleep deficient of sleep apnea? I said, well, you can wake up with a jerk. And the lady says, yes, I do. But at any rate, sleep.
She was referring to her bed partner,
That's
perhaps?
Correct. So sleep is one of these things that I used to talk about the 4 stressors for eyes: UV light, dietary indiscretions, lifestyle issues, stress in general, and I'd have to add the 5th as being sleep. Because even if your sleep is lousy, you need it in the dark, and you know as a way to guide yourself how functional you are throughout the day. And it's critical to eyesight, brain function, and everything else.
Dr. Abel, we've gotten some general recommendations from you. You have said we should all be wearing our sunglasses when we're outside. We should all be getting at least 5 hours of sleep a night. We might argue that many of us need a bit more than that. What are the other things that we should all be doing to try to ensure our best eye health?
Rhythmic breathing, deep breathing. That's one of the reasons that exercise is good. And besides exercise, stretching, so people don't shrink with age, and when they fall, break a hip and break a radial bone in their wrist. Meditation, which again is sort of like rhythmic breathing, is a way of developing that balance between your sympathetic, active, energetic self and your relaxed, restorative self. That meditation, even 10 minutes sitting by yourself and emptying the mind, is just so helpful for realigning yourself and realigning your body. It lowers blood pressure, et cetera, et cetera. The balanced diet is so interesting because nobody really gets a balanced diet, but they do know how they feel. And if they examine their stools on a regular basis, they will know about that regularity, will give them a clue about their GI system and the health of their bowels. They will know if they have cramps. They'll know if they have gas. The body is not quiet. It is a major complainer. You'll get aches, you'll get cramps, it'll give you a clue. And that massage therapy is helpful, as body techniques are very helpful for restoring the musculoskeletal system that take up a lot of the stress. We're all going to have stress. The way to neutralize it is to recognize it, counsel ourselves and counsel others, and even, it may sound goofy, but the spiritual and social aspects of life, being with other people, get you out of yourself and is, in a sense, restorative as well.
Dr. Rob Abel, thank you so much for your good advice on the People's Pharmacy today.
My pleasure. Thank you for having me.
You've been listening to Dr. Rob Abel, Medical Director of the Medical Eye Bank of Delaware. He's an ophthalmologist with a keen interest in both complementary and traditional medicine and author of The Eye Care Revolution, Prevent and Reverse Common Vision Problems, the 3rd edition. The website, eyeadvisory.com. There's a link to it from peoplespharmacy.com.
And we really want to emphasize the value of eye exams, as Dr. Abel was explaining. Not only is it important for preserving your vision, but it also may allow your doctor to make a diagnosis of diabetes, of hypertension, or of thyroid problems. As a person who has thyroid issues myself, I know that when those eyelids get puffy, it means the thyroid's not working as well as it should.
Well, that's all the time we have. Thank you so much for listening. Lynn Siegel produced today's show. Al Wodarski engineers the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. 800-345-7339. Online at uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 978. That number again, 800-732-2334. Online at peoplespharmacy.com.
And next week, we'll be talking about the latest advances in stroke treatment and whether patients and doctors can weigh the benefits and risks of tests and treatments.
When you visit the website, you can check out prescription drugs, herbal medicines, and home remedies. You can share your own experience and your thoughts on today's show.
Why not sign up for our free online newsletter or the free podcast of the show? You don't ever need to miss another People's Pharmacy program again, and you can share it with a friend. It's all there at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.